So tonight we have Piroshka Kopar, who joins us from Washington University in St. Louis. Thank you for staying up late. And we'll talk on ethics in the time of coronavirus. And Milana Trounce, who is here at Stanford on pandemic resilience. I'll introduce them one by one. Milana, your turn. Okay, brief introduction. Milana Trounce conducted research in disaster medicine and bioterrorism response at Harvard Medical School. She led projects of biosecurity at the Center for Integration of Medicine and Technology in Boston, which I believe is also affiliated with Harvard. About a decade ago, she joined the Stanford Medical School, where she now directs the biosecurity program at Stanford, focused on protecting society from pandemics and from bioterrorism. And again, if you go to lasertalks.com, you'll find the full bio. I was just picking a sentence. Okay, all yours.
Great. Well, thank you so much for having me, Piero. I'm excited to be here. This seems like such a rich, serious, set of lectures with so many interesting topics. It's just fascinating how much you cover. Piero, just before I jump in, I want to make sure I'm respectful as far as time. Of everybody's time. How long would you like me to talk before stopping by for Q&A? I'm totally flexible, whatever you think is best.
I think between 20, 25 minutes is
Great.
the
Okay,
ideal.
very good. I wasn't sure if we need to finish at 8 or if we can go a little bit. Okay, great. All right, let me share my screen and I will jump into it. All right. Okay. Can you see it? Can you see the whole thing or the presenter view again?
No, you have to put it in full screen.
Oh, I'm sorry. Okay. Okay. Sorry about that.
You have to share the screen.
Yes, 1 second. Oh, goodness. Okay, I'm sorry. Maybe Piroshka can take or maybe you can talk about something else just for a second. I'm having a little technical issue, but hopefully I can do this.
Okay.
All right.
I see you are sharing the screen.
Okay, I'm sharing the screen, tools, slideshow. Okay, not sure why I can't, okay. Okay, well, let's just do it for now like this, and we will. Okay, so let me just start by saying, so it's I got into the pandemics and the whole idea and the whole issue of biosecurity very serendipitously. I'm not too long of a story to tell right now, but essentially I wanted to give a bird's eye view of the issues of biosecurity and of the issue of the threats from infectious disease more broadly. And everybody's talking about COVID right now, and I'm very happy to talk about COVID, but I wanted to take a step back and really talk about the issue much more in a much more of a bigger picture kind of way. And I want to show you the slide, and no, it's not a mistake. The year is indeed 2019, April 8th. And this is actually a set of slides that I used to brief Condoleezza Rice and George Shultz over a year ago on the topic of potential pandemics. And I am using the same set of slides, not because I don't have a more updated slides. Actually, I have them in the end. But I thought this actually makes a point of how much of what is transpiring now with this pandemic has been predictable. So let me just move through with this. So infectious disease has been a powerful force in human evolution, and this pandemic illustrates the issue. And I'm gonna skip over a lot of this in the interest of time. But bottom line, this is not, as you have known by now, this is not the first pandemic, and we've had a major pandemic with Spanish flu before. But this is really the slide which illustrates kind of a much bigger picture. So we are now witnessing a natural pandemic, but also I want to mention that there is also a risk of accidental pandemics and accidental release of infectious organisms. And by now, I hope you can all see that you can have a major impact from infectious organisms, not just in the form of human lives, but also as far as economic impact. And everything that I will talk today also the same way applies to agriculture and livestock. So what are the forces, to take a step back? How likely is something like this to happen again? And unfortunately, the trends are increasing. The threat is increasing from infectious disease more broadly. And this is due to a number of factors, such as urbanization, globalization, and as well as climate change and new vector ranges. Also, there is an issue with the evolving microbes and different patterns of land use. And of course, we see all of this as the issue, the super vector. Now with people traveling so much more widely, we have billion of cross-border travelers, and the world container traffic has doubled. And also, their food networks are global as well. Ebola. We seem to have forgotten what is Ebola and why it is relevant now. But the problem is with Ebola is that it was again a pattern, an example of a trend. Ebola has started in 1976, was first discovered in 1976, and there's been numerous tiny Ebola outbreaks. So what happened in 2014 to 2016? All of a sudden, it blew up massively, and it blew up so much that over 30,000 people were infected and over 10,000 people died. We tend to forget about it, but Ebola was a much scarier disease than COVID. Again, this is just the statistics to illustrate this trend. Numerous emerging infectious diseases are occurring all the time. Viral hemorrhagic fevers, Ebola is not just one of them, but there are many. And by the way, most pandemics are originating by emerging organisms. Next slide. I want to bring your attention to the fact that although we're very focused right now on COVID, we cannot forget about the rising threat of synthetic biology. And that's a very scary thing. And I know this is kind of a busy slide, but basically with advances in genetic engineering, we can now change organisms to be more infectious and more deadly. And smallpox, the reason why I have a smallpox slide here is because it's a deadly disease which has actually over 30% mortality, a little bit similar to Ebola. It unfortunately killed over 500 million people in 20th century alone. And also, the reason why I have the picture of this ugly looking mouse there is that horsepox, which is a close relative of smallpox, was just synthesized recently as well. And again, what is the issue with the pharmaceutical timelines and nutrition is that as we're witnessing now, it takes time to develop drugs and it takes time to develop vaccines. And usually it takes years to develop it. And again, with COVID, I know we're very hopeful for vaccine, but I think the chances that we'll have a vaccine which is highly effective are frankly not very high. But I think that the chances of having a vaccine which is between 50 to 70% effective is much higher. Many people, it's essentially, why don't we have vaccine now for broad spectrum vaccine for coronavirus, for flu, is because of the issue. It's ultimately a market failure. It's much more profitable to develop drugs, which are can be used on a daily basis, something like an antihypertensive or a medication for cholesterol, than a one-off vaccine. And this is something that we're paying for right now as a society. Surge capacity. I am an emergency room doctor, and the bottom line is our surge capacity is very limited. Yes, we can break out tents like we do even sometimes with normal flu, but ultimately it is very limited. And I think that's not an optimal strategy to go to when responding to a pandemic. And I will tell you what I think the optimal strategy is. Diagnostics, again, from Ebola, and right now, and from COVID, we've learned that unfortunately, it takes time to develop accurate diagnostics. It is challenging to distribute them. It's challenging to regulate them. It's challenging to approve them. But there are more and more options now for advancement of that. And global disease surveillance is difficult. Again, I'm going to skip over some of these slides. Quarantine is something which is not a new concept. Lockdowns are not a new concept. It originated in Italy, actually in the Middle Ages, when when ships were required to dock offshore for over 40 days in order to make sure that people who exited from those ships on the mainland are healthy and don't infect the rest of the population. Okay, with Spanish flu, we've also witnessed other controls, and those measures have worked. Lockdowns have worked, and unfortunately, those entailed the loss of civil liberties in the U.S. And similar to what we're witnessing now, there have been actually a lot of protests and a lot of disobedience, if you will, from the of the population who did not want to do the lockdowns, who did not want to wear masks. In many ways, this is very reminiscent of what happened then. But according to data from the Spanish flu, we know that these measures have worked, and the cities which were more aggressive had fewer deaths. So here's, I think, is ultimately the answer. So I think we need the answer to a bigger question of pandemics, of bigger question of bioterrorism, bigger question to protection of agents challenges posed by synthetic biology, is ultimately interruption of transmission. And think of it as a cybersecurity analogy. Cybersecurity analogy is not possible without firewalls. And it's not all about debugging individual computers while they're infected, after they're infected with a virus. And I think we're trying to do this with masks, but I think, this thinking is not particularly emphasized currently in the public discourse, but I think there's massive opportunities for innovation around this exact point. And if there's anything I would like you to remember from this, it's this point. And I can talk about ways of innovating around this. So we can use technology to lower transmission, things like antimicrobial surfaces, enhancing filtration, ventilation, and such, utilizing the fact that viruses are more likely to die in humid and environments and in environments which are hot. So things like this. So also behavioral and social modifications to decrease transmission. Those are important, and obviously we've relied on them a lot. But the problem is that they're hard. They're harder because they really do affect our way of life, like encouraging telecommuting, everything, limiting social interactions. That's tough for people. And ultimately, we've known about this for a while. Experts have predicted the pandemic is going to happen. Experts have predicted we're not going to be prepared for this. And, this is what we're witnessing now. And so to recap all this is that we're seeing ecosystem imbalance where emerging infectious diseases and pandemic risks are increasing. And we're also witnessing advancement of science and empowerment of individuals with enhanced capacity to do good, but also harm. And again, like I said, technological innovation around major leverage points, such as decreasing transmission and diagnostics, is key. And prompt public health measures are important. And to finish, I want to finish with a quote by Prince Otto von Bismarck, who said, "Politics is the art of the possible, the calculated science of survival, to which Professor Rudolf Virchow replied that survival owes little to the art of politics, but everything to the calculated application of science. And I think the answer is somewhere in between. We've seen a lot of discourse during this pandemic between the politicians and between the scientists and the doctors. And the truth is, I think we all need to come together to really figure out the best solutions for these risks. And just to show you very quickly about possible engineering controls in a pandemic and where I think we should be going. So I think we should innovate around things like physical barriers, around things like optimizing ventilation, filtration, and airflow, and optimizing temperature and humidity controls. There's a lot of innovation actually also around antimicrobial surfaces. For example, we know that COVID-19 does not survive longer than 4 hours on copper, as an example. There are scientists have come up with numerous nano-etched surfaces which kill viruses and bacteria on contact with these surfaces. We should be using more of that. Finally, things like UV light are massively helpful. So how do we optimize ventilation, purification, airflow? We can approach it from low cost to higher cost. Even simple things like opening the windows and doors can be massively beneficial. Introducing HEPA air purifiers, using upper room ultraviolet radiation, enhancing the functioning of the HVAC systems. Also utilizing temperature for disinfection. For example, we've known that police vehicles, actually Ford came up with a solution where police vehicles can be heated up to 133 degrees Fahrenheit for 15 minutes. That's going to kill 99% of COVID. And that's something that's already being used. And of course, UV light is amazing. We've used this technique in tuberculosis to fight tuberculosis in the 30s, 40s, and 50s. It's been massively researched and actually very effective. The challenge is to not shine the viral light on people because it can cause skin cancer and cataracts. But if you can do it in a way which is kept away from the people, that can be a very powerful technique. And it will really cut down on transmission of COVID, as well as really any other organisms which are spread through air. So these are some of the examples. And in the interest of time, I will stop the PowerPoint, and I'm happy to entertain any questions.
Yeah, but now we're curious what is in the other 10 slides because
what is in the look, I mean, I teach a class on this at Stanford. You know, it's a semester long course. I can literally talk about it for hours.
Okay,
so,
let me
I mean, please, this presentation is like 100 slides long, but
okay.
but this is yeah, but
let
I'm
me start with some questions. So let's start from the end.
Sure.
So ventilation, air purification, you mentioned now you mentioned UV light in air ducts. Should these things become mandatory in places like I don't know, restaurants, auditoriums, classrooms?
Yeah, you know, it's a great question. I mean, honestly, I think you know, right now we have safety guidelines, right? Everybody knows that, you know, for example, certain room capacity for it's a fire code, right? You know, you can't put more than a certain number of people in a room per the fire code, right? So I think things like this, you know, I think we should develop a set of guidelines for schools, for, you know, just, you know, in general, for any public building. You can do whatever you want in your house. But I think for any public space, I think we should have guidelines. These things will take time because it does take time to adjust the HVAC systems and so forth. But you know, so as far as the law, you know, I think we're, you know, it's you know, it's a bit probably too early for it to become the law, but I think we could develop a set of recommendations. For example, and I think maybe a better model is, for example, it could be something like this building is green certified, like it's certified to be sustainable, it's certified to be green. A building could be certified to be safe from the standpoint of infectious organisms. And I think, you know, this is something that maybe is not a law, not mandatory, but I think this is something that businesses and other organizations could pursue as a goal.
Yeah.
And frankly, for this pandemic, but also very much for the future, because I think we're going to see more and more of this. The threats are rising, and we're going to have to figure out a way to think about, to be more thoughtful and proactive rather than reactive, for as far as when it comes to dealing with these kinds of threats.
Yeah, I like the idea of just a certificate that says
Yeah,
like it's a green building. Because if you make it mandatory, then the question, of course, who's going to pay the cost?
who's gonna exactly?
Yeah, for small businesses, that become a real issue.
Yeah, I think eventually it might have to be mandatory, but I don't think we should necessarily start there.
So in one of the early slides, you mentioned globalization, urbanization as factors that make it more likely that we'll have other pandemics. One thing you didn't mention is fast travel in particular. China has a fantastic network of high-speed trains, but now we know that's an easy way to spread the virus thousands of kilometers away. And of course, there are the airplanes. The airplanes probably brought the virus first to Europe, then to New York, and so on. So is there anything we can do about this?
Well, I mean, it's interesting. I mean, absolutely. I think basically, really, the fact that we can travel like we can now is basically the major factor in the fact that now pandemics, that now infectious disease outbreaks can spread like fire. So, yeah, there are many things we can do about this. Absolutely. For example, I think we can design our vehicles to in a way that makes them less likely to transmit. And I think utilizing exactly the same principles that I've outlined, the same physical properties of the virus, would help. For example, you can massively increase, you can design the train, for example, with in a way that can um, with much enhanced ventilation. I mean, they're very cheap. I mean, you could just open the windows. If you're in India and you can't invest and, it's COVID, just open all the windows and, it might be cold. And I mean, if the air quality allows, just open the windows. That alone, very, very simple, costless intervention, can decrease transmission by, by huge amount.
Yeah,
You
but
can,
the trend in the last 10, 20 years has been the opposite. Now, even in developing countries, you find buses and trains where you cannot open the windows.
yes. So, I mean, again, you can design engineering controls around that. I'm just saying, I'm just giving this as an example of something that can be done without any cost. But you're right. And even in some buildings, it's hard to, even some hotels, it's hard to open the windows when
Right.
that, in fact, that may
Right.
be the easiest. I mean, there's so many studies which have documented actually sometimes the fact that infections can spread through the HVAC system, through the air conditioning system. For example, studies out of Hong Kong with SARS. Um, but again, we need to proactively think about these risks. I think people just by and large haven't thought about these risks, quite frankly. I think this pandemic is a big wake-up call. And I think in a big scheme of things, if you look at it over next 50 years, it might be a blessing in disguise, because now we might be developing something that will protect us from something far scarier than COVID, to be quite frank.
That's a good point, optimistic point.
Yeah.
That my other question is, so it's I mean, there's so many studies that are tentative, but it sounds like there were super spreading events that account for the majority
Yes.
of infection, at least at some point. And now I don't
Right.
know in October. So in particular, I can think religious events, I believe both in Korea and Iran. And in Europe, they are blaming the Champions League games, soccer events. So there are some events are potentially super spreaders of infection. Is there something we can do about this? Should there be warnings when people go to one of these events? I don't know what.
Yeah. So here's the thing. So yeah, I mean, there is a lot of data emerging on this now. So as many as basically 20% of the people can be responsible for as much as 80% of transmission. So most people who are infected with COVID actually do not transmit. And so, and I mean, again, the data for this is very strong. What can we do about it? we should try to avoid situations where transmission occurs. I mean, this is for COVID. We know, for example, that outdoors, because again, the data point to the fact that most of the transmission is through air. These super spreader events generally do not occur by one person touching 100. They're generally occur because it spreads through air. So if we avoid situations where a lot of crowded people are in an environment which is poorly ventilated, we will avoid these super spreader events. So holding as many events as possible outdoors will greatly decrease the risk of these super spreader events. And also, quite frankly, again, like I come back to the fact that we need to improve ventilation. Ventilation in rooms. We need to consider using upper room germicidal irradiation to use UV light. And in the most immediate term, yeah, we shouldn't be having large gatherings for COVID until we've designed these engineering controls, or we should be having things outside.
And even outside, a problem in many countries is the line. I mean, soccer is
Yeah.
outdoors, but the line to get into the stadium is very long and people are packed.
Absolutely. So social distancing, and outdoor. I mean, you could have a big event if it's outdoor and if it's socially distanced. But otherwise, I mean, at this point, because in general, our buildings are not designed for the most part. These things are best avoided for COVID in the current pandemic.
In one slide, you mentioned the vaccines. It takes a lot of time and a lot of money, but let's assume we solve the problem of money, but it takes a lot of time to develop a vaccine. Now, what we are doing now, we are waiting for the virus to show up and kill people, and then we start developing the vaccine.
Yeah.
I was wondering, are you aware of anybody who has been trying to automate vaccine manufacturing even before the virus arrives? I mean, you just create a lot of vaccines for potential diseases, and then you hope when one comes, the actual one is similar to one of the vaccines that you have developed.
No, absolutely. I mean, actually, so government in the US has been pouring a lot of money into trying to develop platform technologies. But the issue with this is that, you cannot, there are infinite permutation of different viruses. Even, for example, take the flu vaccine. We have to get a different flu vaccine every year, right?
Good point.
The flu. And that's because, the vaccine has to be specific to this kind of strain. People have been working for decades to develop what's called the universal flu vaccine. So flu vaccine, which would work for all the strains. So far, no success, right? I think we need the same thing for the coronavirus. We need a vaccine for the universal coronavirus vaccine, because we've had SARS, we've had MERS, now we have COVID. 19. So absolutely, we need a broad spectrum vaccine that works against these different viral categories. It's easier said than done. Also, another approach that people have utilized is people have, people have basically taken some stages of development. So essentially, U.S. government, for example, DARPA in particular, as well as BARDA, they've funded some development of vaccines against different ages up to a point. So maybe they would say fund phase 1, but they wouldn't fund phase 2 and phase 3, which actually most expensive. But in order to cut down time, the U.S. government has certainly been investing in a number of platform technologies where there's at least some of these vaccines are at kind of early stages of development to try to cut down on some of these times. But honestly, I love vaccines. Don't get me wrong. I think, they're wonderful. But given the dynamic nature of the threat, given the fact that we can have a pandemic anytime due to a variety of organisms, due to the rise of synthetic biology, I think the broad answer to this threat is not necessarily only vaccines and testing. I think the answer should be around building firewalls. I think it's all about the firewalls and building the engineering controls, because that works for everything, because we can't possibly, these things we might be having new pandemics, or we might be introduced to by terrorism agents like every day. You can't be popping vaccine every day. The math, it just doesn't work. So I think, again, better engineering controls, better personal protective equipment, things like that. I think ultimately 50 years from now, this will be our answer rather than kind of vaccines. Because the thing is, with vaccines, you can develop them, but it inevitably takes time to test them. You can run modeling studies, and you can try to predict, with a computer, okay, which ones will have side effects, or which ones will kill healthy people. And you can do some of that. You can eliminate some of the risk with quantitative modeling. But ultimately, I mean, human body is just too complex. You can't model everything. And ultimately, it takes being, this clinical phase 3 clinical trials really to determine the risks. And those things take time and a lot of money. That's the most expensive portion of the trial of vaccine development, is the clinical trial. So ultimately, there will always have a lag just due to that alone, even if our kind of technology is fast.
Wow, very interesting. We could keep talking for hours.
Oh yeah, we could talk for hours.
I want to take your class.
Yeah, please.
Okay, thank you very much.
No problem.